sponsored by ARA.
Welcome back to We Are Austin. We're thinking pink all of October for Breast Cancer Awareness Month, but preventative care is something you should consider all year long. Dr. Onachlam, an imaging radiologist from ARA, is here with important life-saving advice. Thanks so much for being with us.
Oh, no problem.
Will you tell me, did I say your last name right?
Oh, you did it great. Great job.
Okay,
yes,
I didn't want to get that wrong. This is important info, and you have so much to share. So first off, how often and at what age should women be getting mammograms?
First off, women should start getting mammograms at age 40.
Okay.
That is when breast cancer significantly increases in women. That's the age that it starts to significantly increase. And then after age 40, it should be yearly.
Oh, okay.
Yearly.
So once a year. And so here's what we're looking at right here.
This is a normal mammogram, and we do usually 2 images on both sides. This is our up and down image, and this is kind of our side image. And this is all you need to do. It takes less than 15 minutes to do this, to come in and do this. So.
And it can have such a huge impact.
Huge impact.
Stay on top of your health.
Huge.
So let's say, what happens if something is found on a mammogram?
Okay.
What are the next steps?
Number one thing is don't panic.
Okay.
Because I feel lots of women don't want to come back in. They have a lot of anxiety. Don't panic. All it means is that we want to get a couple extra views, a couple extra images to see what's going on in your breast.
Gotcha.
Usually most women just walk out the door and there's no problem whatsoever. We usually have you come back and you'll probably get some more mammographic images, and then you might also get an ultrasound, which is a kind of a partner to mammogram that really helps us evaluate the breast.
So can you tell us a bit about breast density and its relation to breast cancer?
Sure, and I'm going to show you that this is a dense breast, and I don't know if you can tell the difference between the last one and this one right here. This one has a lot more white in the breast, and it's harder for us sometimes to find breast cancer in this type of breast versus the other breast. So women who have more breast density are more likely to actually have breast cancer because they actually have more tissue for breast cancer to develop in.
Oh, wow, interesting.
And then on top of it, it's harder for us to diagnose the breast cancer based on mammograms.
Yeah.
Which leads us into the
3D mammography, right?
Exactly, yes.
So tell us about how that process works and how it's different.
Yes. So we love 3D mammography. So this is actually a photo of a case of where a patient may get called back to get a mammogram. So I don't know if you can see this little object right here, but we would potentially call you back to kind of reevaluate that and see what that is. This ended up being a cyst.
Gotcha.
So 3D mammography is the latest and greatest in breast imaging technology, and basically it's like a mammogram. It's the same thing, but what happens is, you know, the breast is a 3-dimensional object, and before we were putting a 3-dimensional object into a 2-dimensional image.
Right.
Now we're using 3D technology to put a 3-dimensional object into a 3-dimensional image.
Yeah.
So on a mammogram, we have a 3D tomosynthesis will arc across the breast, and it will cut the breast into slices, and that sounds weird, but it does slice the breast into slices to separate out the tissue better.
And I believe this is what we have the video of as well, right?
Correct.
Okay, so you can bring that up if you want.
Yes.
And then what happens?
And so now that we have the tissue more separated out, we can see the tissue better, and we can see within the tissue potentially if there's any abnormalities within the tissue. We're able to tease out that question a lot better. And then it's been found that we decrease the number of times people come back to get that extra image as well. So 3D tomosynthesis is really helping us all in breast imaging.
It sounds like it. It's really thorough, and it can help provide all that information.
Absolutely.
As we talk about this month is based on awareness, but what are things people can be doing to think about prevention?
Prevention. The number one thing is get your yearly mammogram starting at age 40. Knowing your family history is also helpful. If you have a family history of breast cancer, being aware of that, making sure that you come in, get your mammograms at an age that's appropriate for you.
Yeah.
You know, they always say eating right and exercising, but I say, you know, just staying on top of your own health is the most important thing. So age 40, get your mammograms, make sure you get them yearly.
Okay, that's such helpful information. And just in thinking about a breast imaging provider, what should you be keeping in mind as you decide where or who to visit?
I think it's super important, like at Austin Radiological Association, we have facilities that are staffed by breast-trained people that went to radiology residency and then did a breast imaging fellowship like myself. We can read all of the modalities that we image breast with, which includes mammogram, ultrasound, and MRI. So you want to be able to go to a place where you can get like a one-stop shop and be able to have all of those things in one place so that you don't have to keep going all around everywhere to do that. And you want a highly trained person reading your exam.
Yes, we do. Thank you so much for the work that you do. So there's the information on the screen, the phone number and the website if you want to visit or just give them a call and talk to people who are so highly knowledgeable like you. Thanks for being with us.
Oh, no problem.
All right, stick around.